There really isn't a wrong reason to seek therapy. I do see a lot of times that people feel like they should wait until things are really bad or in crisis. But I mean, really, if you're feeling like, and you have the means to, that you just need to talk to someone, you need to be listened to, you need to process something that's going on, you need help making a decision. Your relationships aren't what you want them to be. There are lots of valid reasons to seek therapy. So. My name is Dr. Christian Vargas. I'm a licensed psychologist, and I've been licensed in the state of Kansas for about 13 years now. I got my degree here on the Lawrence campus at KU, and did my internship at University of Missouri, Kansas City, in the counseling center there. And then my first couple jobs were also in college counseling centers. And I've been in private practice working for myself for about 2 years now. I got 3 degrees from KU. I liked KU. So I got my undergrad in psychology at KU and then applied for the master's in counseling psychology because I knew I was interested in being a therapist. And in the process of completing my practicum at the VA, the Veterans Administration in Leavenworth, and working with veterans there, I had a supervisor who asked why I wasn't going on to get my PhD. And I said I hadn't thought about it, actually didn't know anyone or ever have a relationship with anyone who had gotten even a master's, so that seemed like the capstone to me. But he asked, what is it that you want to do? And I said, I really want to work one-on-one, individually, possibly do some group therapy. I think I want to work with college students, maybe eventually, broaden that. And he said that, it would make most sense for you to get a PhD so that you have all of those opportunities available to you. And so I applied for the PhD program at KU. And completed that, and so that involved coursework, completing my dissertation, and I feel like where I really found myself as a therapist is on my internship at UMKC at the counseling center there, and just being able to be fully immersed in full-time working with individuals in therapy. I just really enjoy being part of the process of someone exploring themselves and being really open and vulnerable. And trusting me to help them in that process, to sit with difficult emotions, to accept them for who they are. I just really feel honored when people allow me to do that, and so that solidified for me that that was the direction I wanted to go. The purpose of therapy, I think, varies based on why a person is choosing to initiate services. And so that could be related to something situational. Obviously, right now we're seeing a lot of people come in because of the stress of the pandemic and the changes that that's meant for everyday life. And their mental health is obviously impacted by that as well. Sometimes people come into therapy to learn more about themselves for identity development. Sometimes it's related to a major life change like starting a new career, loss, or moving. And sometimes there's long-standing issues like diagnosed disorders like anxiety or depression or ADHD. So I think the purpose really depends on the person and what they're looking for, what their goals are. And I see my role as helping that person define those goals and then developing collaboratively a treatment plan to reach those goals so that they can feel that how they see themselves living their lives is congruent with what's actually happening for them. Allow yourself to think about why and why now, what feels like your motivating factors to help clarify for yourself what your goals are. And then to allow yourself to do some research. So my suggestion usually is to go to psychologytoday.com. That website's a really good resource because you can look for therapists and filter them by different categories. So if you're feeling like you want to work with someone who has shared identities with you or has a certain approach to therapy like cognitive behavioral therapy or interpersonal therapy, or if you're just looking location-wise, you can kind of filter through those things. You can also look at if they accept your insurance or not, what their fees are, if they're doing online therapy. So lots of great information that you can get up front. And then once you kind of narrow it down to a list of people, you can read their profile to get a sense for how they describe how they work and if that feels like it could be a good fit for you. And then I think also when you reach out for therapy, I notice a lot of times that clients are quick to answer all of my questions. And when I ask if they have any questions, they're sometimes surprised by that. But feel free to ask and think about it as an interview for you finding a therapist as well. Whatever questions you might have about what it would be like to work with that person, how they bill, where they meet, if they have experience working with the type of things you want to work on, and allow yourself to also think about asking multiple providers to see who's the best fit for you. Some of the biggest challenges in seeking therapy are accessibility, obviously finances. A lot of that has been, I think, helped by the reduction in stigma over the years. Like I'm seeing people more willing to seek therapy, and the fact that I guess one of the maybe good things you could say that has come out of the pandemic is the ability to accept that sometimes people need to meet via video conferencing instead of in person. And so, like, personally, I have several clients who are in rural areas of Kansas now who previously hadn't sought therapy because they had one therapist in their town who knew everyone. And so they didn't feel as comfortable and now are able to seek services. Another piece is, like I said, cost. And depending on where you're located, there may be places like we're very lucky to have Burton Ash Community Mental Health Center. We have Heartland. We have options for people where you can work on a sliding scale. The way I work is I accept Blue Cross Blue Shield insurance, and then I also have a couple of pro bono and sliding scale slots. And so it's different for every provider, but I know that those things can really hinder people from receiving services. When a new client reaches out, I ask them to fill out some paperwork ahead of time. And when they actually come in to meet or click on the video link to meet right now, I tell them up front that I'm going to ask you a lot of questions about your background and history, what's bringing you in, what are your goals, and how can I be helpful. And so that's the majority of the first session, is really just kind of getting to know why are you here and how I can be helpful. And then also I leave space for them to ask any questions of me. One of the questions I ask that I think is really important is, what are your expectations of therapy? If you've had previous therapy, what's been helpful and that you're thinking like this would be helpful again, I'd like to see that, or what's not been so helpful, I know this doesn't work for me, let's please not go down that route. And also kind of a sense for when you're thinking of, I'm starting therapy, are you thinking I want to meet weekly for 6 weeks and then be done with this? Or are you seeing this as, we'll see where this goes, I'm willing to continue meeting, we'll check in once a month. So some parameters around their expectations. Well, I think it's a good opportunity for a conversation. I work pretty collaboratively, so I check in with my clients regularly about how they think therapy is going, if it feels like we're working towards their goals, or working on the right goals. And so hopefully that can come up organically, but even if, someone's just feeling like this is something I need to talk about and they bring it up, that's great. I think it's an opportunity to see if there needs to be changes in the work that we're doing. And maybe that's the case, to realign and get on track. Or it might just not be a good fit. And so sometimes that happens because, people are people. And so your personality just might not vibe with that person, and that's okay. Or you might be wanting to work on something that they don't really have expertise or experience in, or want a type of therapy that they don't provide. And so, if someone's coming to me for a type of therapy I have not been trained in, then I'm prepared to provide them with resources and help figure out how to get them connected with someone who could be helpful. Boundaries are a really good thing, so I can appreciate that. And not everything is just kind of on the table because you're in therapy, and so I respect those boundaries. If someone brings something up and alludes to the fact that they might want to talk about it eventually, I respect that, and we go at the client's pace, or if it's just completely off the table. I respect that as well and focus on what they're here for. Oftentimes in therapy, you're getting to know a person and you're getting to know that whole person. And so as someone who's interested in human behavior, I can sometimes see things that I might want to talk about or be interested in. But if that's not why the client's here, or it's not aligned with their goals, it's not my job to kind of move things in that direction. So yeah, I just kind of respect that boundary and go with what the client feels would be most helpful. I think it's important to also point out that there are limits to confidentiality in therapy. And so if someone brings up that they are thinking about harming or killing themselves, and there is a real risk of that happening, or they know of the threat of safety of someone else, like a child, elder, disabled person, there are limits where I might have to break confidentiality to keep that person safe. And then also reporting around things like abuse of children. And so I make sure that that's known at the onset through our paperwork. And if it feels like someone is starting to talk about those things, I remind them, and so that they feel like they are providing that information with consent, knowing where this could lead in terms of what my duty is. And hopefully we can work together on, what makes most sense is also, covering what my legal responsibility is and keeps the person in harm's way safe. Of course, that fear comes up of what happens if I share, thoughts of self-harm or suicidal thoughts. I try to, like I approach most things, work collaboratively with clients. And so I let them know up front what those boundaries are and where my duty is to keep them safe. But obviously, we're going to be working to try and keep that from being the situation. And so what I find most of the time is that people are experiencing like passive suicidal thoughts and are afraid that that is going to automatically lead to hospitalization, which is not typically the case. And so really explaining to them that my goal is to help understand what they're experiencing and how we can reduce any stress or distress they're experiencing and provide resources, and that is kind of a last option for me. And that's the way I think about it, especially with working with people from marginalized identities who have historically not very good relationships with some of the institutions involved in that process. And so I encourage openness. I plan on my part to be completely open about what my responsibility is and how we can work together. Oftentimes there's things we can do like creating a safety plan. We can consider changing treatment, increasing treatment, or adding supplemental treatment like medication or group therapy, doing something to reduce the symptoms that are leading to those suicidal thoughts or self-harm thoughts, rather than jumping to hospitalization. One of the questions I always ask in my first session is, what are your salient identities? And I ask the new client to talk to me about that a little bit and how that might come to play out in their goals and their reasons for reaching out for therapy. And then I also share that I obviously have some visible identities, I have some invisible identities that we may share or may not share, and those obviously influence my worldview, my lens, and so the questions I ask or how something falls on my ear is going to be influenced by that. And so anything I'm talking to you about, I'm going to kind of check that out with you and say, that's coming from how I hear it, my worldview, my experience. What does that mean for you? How does that land for you? And so to me, creating a safe space means letting people be visible in the room and talking about those things up front. and then leaving room for that to come up as needed. I also think it's really important to continue to stay educated, and so I did complete my PhD at KU, where there was a focus on some multicultural counseling, but I continue as part of my continuing education to stay licensed, to find, depending on what clientele I'm seeing, more learning opportunities so I can be up to date on what's best in terms of therapy techniques and research.